Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're talking about Parkinson's, which is a chronic neurologic disorder and will very likely be on your Nclex. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Thank you so much for coming back and watching another video. I'm talking about Parkinson's today. It's maybe not the most exciting thing to talk about, but it is a relatively common chronic neurologic disorder. So there's a very good chance you're going to see it on your Nclex. You know, this channel is a part of the greater Clinic Review organization. And you can go to clinicreviews.com to sign up for our online on-demand Nclex review. It's 21 plus hours of review with Mark Klimek himself, the best ever, the total GOAT. We also have a tutoring package, a small group tutoring package, and we have streaming service. I always forget that. Can't remember what that is. And then we've got the Blue Book back here. Mark Klimek published it. You can go to Amazon and just type in Blue Book Klimek and it'll pop up. It's content that you need to know. It's formatted as just a factual kind of a flashcard type format for you to learn the content. And this is coming from the Blue Book. You know, I teach this content as I go through the questions. My expectation is that you've either already had this in class or you've reviewed it in the Blue Book. And so we're going to go through the questions and we're going to practice these questions. And I'm going to help you learn how to think. Now, remember, this is all about learning how to think. Okay. So pay attention. Sometimes the questions are just kind of knowledge because I'm just testing to see if you know the information, but some of them are prioritization and other types of questions. While caring for a patient newly diagnosed with Parkinson's, the nurse explains this disease is primarily associated with a deficiency of which neurotransmitter in the brain, and the answer is dopamine. Either you know that or you don't. So low dopamine is Parkinson's. High dopamine is Huntington's chorea. Huntington's chorea it's a pretty miserable disease. Parkinson's isn't fun, but Huntington's chorea is more terminal but faster than Parkinson's, and it's uncontrolled movements. So think high dopamine, you have a lot of uncontrolled movements. That'll help you answer some of the questions that we'll get here in a minute. Which classic motor symptom is most commonly recognized as an early manifestation of Parkinson's disease? Bradykinesia, mask-like facial expression, dysphagia, and postural instability. So for me, I would look at this and go, well, mask-like facial expression, I don't think is early. Dysphagia, probably not. I would think that if people have difficulty swallowing early, that just doesn't seem like an early symptom to me. So then I say, well, what does bradykinesia mean? So I put this question in here really to make sure you know what the word bradykinesia means. Kinesia, think kinetics, think kinesiology. Kinesiology is a major you can have in college where you learn all about movement and how the body moves. So kinesia is all about movement. And then the word brady means slow, right? If I have bradycardia, bradypnea, it's a slow something. So this is a slowed movement. Bradykinesia is slowed movement. So I think would they be more likely to have postural instability? Because I've already ruled out B and C. So do I think they'd be more likely to have postural instability, sort of have trouble keeping their balance, or bradykinesia, just slowed movements? And to me, and this is in fact the right answer, but the bradykinesia is really one of the earliest signs. People just have slowed body movements. They also could have tremors. That's another early symptom. A patient is diagnosed with Parkinson's disease. Which of these symptoms or signs would the nurse expect to find? So these are just signs and symptoms of the disease: pill rolling tremor, tachycardia, rigidity, flatter mask, facial expression, excessive blinking, or shuffling gait. Now, I think if you've watched any of my other videos, you know I would rather have you underselect than overselect. The most common error with SATA questions is overselection by just one, which doesn't mean you just automatically like remove one answer. Okay, that's not what I'm saying. What I'm saying is we have a tendency to kind of know what the answers are, and then we're sort of wondering about this other one, right? So I may go, well, I know A, C, and D are right, but I don't know about E. And so we have a tendency to go, well, I'll just pick it. Okay, if you're not sure about it, don't pick it. Okay, I'd rather you not pick it than pick it. So tremor, a pill rolling tremor, to me, that makes sense. That sounds like something that I've heard a lot about tremors and pill rolling. Sounds right for me for Parkinson's. Tachycardia, that's not something I've heard about. And for a neurological disorder, it doesn't really make sense. Rigidity, I do know rigidity. If I just think about people I've taken care of with Parkinson's, I certainly know rigidity as a symptom. Flat or masked facial expression, a mask-like expression where they don't move their facial muscles very much. It has a lot to do with rigidity of the facial muscles. So yes, that sounds good to me. Excessive blinking. Well, if I know bradykinesia, which is slowed movements, is common, and if I know a mass facial expression, so excessive blinking seems to sort of be the opposite of those things. So I go, excessive blinking? I don't know. I've never heard of that. And it sort of isn't consistent with everything else being slowed and rigid, right? Shuffling gait, yes, that definitely seems right to me. So I know pill rolling behavior, pill rolling tremor, rigidity, flat mask facial expression, and shuffling gait are all consistent with Parkinson's. So instead of going, well, I don't know, just pick the ones you know, unless one of the other ones just, maybe you say, well, one of these other ones I don't know, but it makes a lot of sense. If it makes a lot of sense, you can pick it, but don't just pick it because you don't know. Like, I don't know, I don't want to miss anything. No, I'd rather have you underselect than overselect because we're much more prone to overselection than underselection. A patient newly diagnosed with Parkinson's disease is started on levodopa, carbidopa, which makes sense if it's a low dopamine. Which side effects should the nurse monitor for most closely during the initial phase of therapy? Diarrhea, orthostatic hypotension, weight gain, hyperkalemia. So which side effects? So adverse effects are things that make us stop the medication. Side effects are things that we teach the patient how to manage. So side effects, so I'm not looking for something that can kill them, because if it could kill them, it would be an adverse effect. So diarrhea, that sounds like maybe something. I know there's a lot of GI side effects for medications. Orthostatic hypotension, I mean, that's definitely something that's a side effect of a lot of psych drugs. So that is a side effect. Weight gain, also a common side effect. Hyperkalemia, I don't know hyperkalemia being a side effect of very many meds, except with maybe some potassium sparing diuretics. And it's not something they can really monitor for at home. So I'm going to cross off D. So now obviously y'all, I know what the right answer is here. So I'm teaching you how to think through it if you don't know the right answer. So you think, okay, it could be A, B, or C. I guess I could do eeny, meeny, miny, mo. But instead, let me think through this. If I want them to closely monitor for it, is weight gain something they need to closely monitor for? Weight gain is a pretty common side effect of a lot of meds. Certainly every psych med out there can cause weight gain, and I'm sure some others too. So I think, is that really something that, I mean, why would I tell them to monitor for it? I might say, hey, you might gain some weight, but I don't know that I'd tell them to monitor for it. So that just doesn't make a lot of sense. So I'd cross off C. So I go, are they going to monitor for diarrhea? Okay, maybe. Or orthostatic hypotension. Why would I teach them to monitor for orthostatic hypotension? It's a common side effect. Well, because if they stand up, they could pass out. So I would want them to monitor for that. And even if they're not checking their blood pressure, I would tell them, look, you need to stand up slowly, sit up slowly, right? Because your blood pressure could drop when you do that. That seems to make more sense in the context of the question and what it's asking. And that is the correct answer. But I want you to understand that you're going to get farm questions on the Nclex. The most common farm question on the Nclex is about side effects. You have to be able to think through side effect questions using a lot of common sense. You need to know what are real common side effects, like heart rate changes are real common side effects. GI side effects are very, very common. Weight gain is common. Sedation or getting sleepy is very common. Like, think of all the over-the-counter cold medicines we take that can cause drowsiness, right? So you need to sort of think through what are common side effects, and then what would I do about them, and which ones do I really need to teach about because they can cause problems. Like weight gain doesn't really cause a problem. It's uncomfortable. I may not like it. I have to get new jeans or leave my jeans unbuttoned, but it doesn't really cause a problem other than that. Whereas orthostatic hypotension can cause some injury if they stand up too fast. The nurse is teaching a patient about trihexyphenidyl, which is Artane, an anticholinergic used to treat Parkinson's disease. Which statement by the patient indicates correct understanding of a common side effect of anticholinergic medications. I may have to increase fluids because this medication can make my mouth dry. This medication will likely make me produce more saliva. I should reduce fiber in my diet because of potential diarrhea. This medication may cause me to have wet skin due to sweating. Now, this question actually tells us it's an anticholinergic. If you've got the blue book and you've studied the Parkinson's information, you know there's 2 anticholinergics that are used. There's at least two dopaminergics, which are dopamine replacers, and then there's anticholinergics, a couple anticholinergics. And anticholinergic side effects are very common with a lot of medications. So here's how I want you to remember anticholinergic side effects. Think dry and dilated, dry and dilated. So it can cause dryness of the mouth, dryness of the GI tract. If you have dryness of the mouth, you just have a dry mouth. If it's in the GI tract, you can have constipation. It can also cause urinary retention because the bladder doesn't contract. The bladder dilates, right? Dry and dilated, it dilates and it doesn't contract so that they have trouble emptying their bladder. And then it also causes dilation of the eye, so it causes blurry vision. So think dry and dilated for anticholinergic. So if we think about this is an anticholinergic medication. It says which statement by the patient indicates correct understanding. So I'm looking for the true statement. I may have to increase fluids because the medication can make my mouth dry. Well, that's true, dry and dilated. This medication will likely make me produce more saliva. Well, that's the opposite of A. They can't both be true. So it's A in this case. I should reduce fiber in my diet because of potential diarrhea, actually constipation, dry and dilated. This medication may cause me to have wet skin due to sweating. Well, sweating is the opposite of dry. So no. So the correct answer is A. And I think I changed the wording on this question a little bit, but it's still the same question. So I had taken out the anticholinergic, and I don't know why I did that. The nurse is preparing a medication teaching session for a patient with Parkinson's disease who will begin levodopa-carbidopa. Which points about this medication should be included in the teaching? Select all that apply. Take medication with high protein meals to increase absorption. Change position slowly to avoid dizziness. Report any involuntary muscle movements or dyskinesias. It may take weeks to see the full therapeutic effect. Darkening of the urine or sweat may occur. Stop the medication abruptly if mild side effects appear. All right, so I may say, well, I don't know much about the side effects of levodopa-carbidopa, but I do know that Parkinson's it causes rigidity, it causes tremors, causes gait changes, instability. So I think if they're taking this, probably the opposite things are gonna occur. So let's go through these again. So take medication with high protein meals to increase absorption. So that does not sound like a good idea. The only reason I tell people to take a pill with food or milk is to reduce GI side effects. And I certainly don't tell them to take it with high protein meals. Like that just doesn't sound right to me. That just doesn't sound right. I'm just using my common sense and clinical reasoning here, which you have to use. Like trust your gut a little bit on this and go, that just doesn't sound right. And in fact, high protein diets actually decrease absorption for the carbidopa. So I'm not going to do that. Change position slowly to avoid dizziness. That just seems like a good idea. We were talking about taking medications and what do you have to watch for initially. I mean, that just sounds good. Report any involuntary muscle movements or dyskinesia. So bradykinesia is slowed movement. Dyskinesia is different disordered movements. And I know that Parkinson's causes rigidity, but increased dopamine is Huntington's chorea, and that causes uncontrollable movements. So certainly if I'm giving someone dopamine, it could cause uncontrolled movements. So yeah, that could happen. It may take weeks to see the full therapeutic effect. I don't know. I might say to myself, well, I don't know how long it takes, but it is a chronic disorder. Most of the time when we treat chronic disorders, it doesn't turn around just like that, right? So that sort of makes sense to me. It may take weeks to see the full therapeutic effect. Darkening of the urine or sweat may occur. You're going to have to memorize that. That's just a side effect of the levodopa-carbidopa, darkening of the urine. Stop the medication abruptly if mild side effects appear. No, side effects are things we don't stop the medication, particularly mild side effects. So I told you I'd rather have you under select, but I am using this to teach you. So I would never encourage someone to use high protein foods with their medication. So don't do that. B makes a lot of sense, just considering that hypotension is a common side effect with a lot of meds. And it is a neurotransmitter, right? It's a neurotransmitter. Dopamine's a neurotransmitter. So it's the fact that it could alter blood pressure just sort of makes sense to me. C, I'm confident is the right answer. E, I'm confident is the right answer because I know that fact. And then D, I may say, well, I'm not sure, but it makes sense. Now, if you said, well, I didn't pick D because you told me you'd rather have me underselect than overselect, that's fine. It really is. You can, I would memorize this, right? Just memorize the fact that it can take a little while to work. So this is just a learning opportunity. A patient newly diagnosed with Parkinson's disease is experiencing significant bradykinesia. Which nursing action should the nurse do first? First, administer the first dose of levodopa. That seems good. Teach the patient about physical therapy exercises. That doesn't seem like the first thing I would do. So unless I don't like something else, I'm going to cross off B. Assess the patient's swallowing ability. Well, that seems like a good idea. Provide emotional support and counseling. That doesn't seem like the first thing I would do. So I'm going to cross off B and C. So when you have a first question and you have two answers and you like them both, you have to say, well, I'll do this and then do this. I would administer the first dose of levodopa and then assess their swallowing ability, or I'd assess their swallowing ability and then administer the first dose of levodopa. Well, that makes sort of sense that I would do C, doesn't it? Levodopa, as far as I know, we only give it orally. I think there's some new testing out trying to give it IV, but I don't think you're going to be tested on that. It's not standard of care by any means. So the first thing we do is assess their swallowing ability. What is the most appropriate nursing intervention to improve mobility in a patient with Parkinson's disease? Appropriate nursing intervention to improve mobility. So when it's a question specifically about something like what will improve mobility, what I do is I take the answer and I say, this will improve mobility, true or false. Encouraging the patient to exercise only when feeling strong will improve mobility. That doesn't seem right to me. Using muscle relaxants to increase compliance with exercise will improve mobility. Well, muscle relaxants may prevent rigidity, but it doesn't seem like it's going to improve to increase. I don't know. That just doesn't make sense. Maybe. I'm going to say no unless there's nothing else. Limiting ambulation to twice per day to conserve energy will improve mobility. I don't see how that doesn't improve mobility. Instructing the patient in walking techniques that emphasize lifting the feet and wide base gait will improve mobility. Well, that makes sense to me because one of the thing about Parkinson's is a shuffling gait. And what they do is they don't pick their feet up and they don't take a long stride. One of the things you can tell when someone, as a kind of an early sign of Parkinson's, is their stride starts to shorten up quite a bit. And so if you teach them to pick their feet up and to lengthen their stride, they just have better balance. They can move a little faster, and it's just a better way for them to walk. But they have to think about it. It has to be intentional because the Parkinson's is going to make them want to shorten their stride and shuffle. But if possible, you want to teach them to do these things. So that's a good thing to improve mobility. Which symptom is not typically associated with Parkinson's disease? All right, so let's see. So what I'm going to do is say tremor at rest is associated with Parkinson's disease. That's true. Bradykinesia is associated with Parkinson's disease. That's true. Hyperreflexia is associated with Parkinson's disease. It's not one I'm familiar with. Postural instability is associated with Parkinson's disease. Well, I know that's true. So the correct answer is C. And I put this question here specifically. I wanted you to make sure that you know that tremors are more pronounced at rest. If they actually go to move their hand or point to something, their tremor stops. So with Parkinson's, it's a tremor at rest as opposed to tremor with movement. A patient is starting on benztropine, Cogentin, for Parkinson's disease management. Which instructions about anticholinergic side effects should the nurse provide? Select all that apply. So this is another one of the meds in the blue book that Mark says you need to know. Let's see. Which instructions about anticholinergic side effects should the nurse provide? Okay, increasing fluid intake will address an anticholinergic side effect. Remember, anticholinergic is dry and dilated, so increasing fluid intake would address the dryness. Chewing sugarless gum or a hard candy for dry mouth would address an anticholinergic side effect. Yes, because dry and dilated. avoiding foods high in fiber to reduce GI motility would address an anticholinergic side effect. No, because constipation is a problem. Getting up slowly to prevent orthostatic hypotension would address an anticholinergic side effect. Well, here you have to be pretty confident, because you might go, well, that's a common side effect, but it's not an anticholinergic side effect. I told you this is specifically asking about anticholinergic side effects. Anticholinergic side effects are dry and dilated, okay? Dry and dilated. So orthostatic hypotension is not an anticholinergic side effect. Monitoring for urinary retention would address the anticholinergic side effect. Yes. Remember, dry and dilated, so they have trouble emptying their bladder. Expecting excess sweating, especially in hot weather, would address the anticholinergic side effect. No, because it's dry and dilated, so we're not going to have excess sweating. So those are the things that we would teach them to watch for. When planning dietary interventions for a patient with Parkinson's disease, which recommendations are appropriate to address nutrition and medication effectiveness? So these are dietary interventions for people with Parkinson's. Increasing fiber intake to reduce constipation. Yes, actually, constipation is a occurring symptom. Most of the symptoms with Parkinson's are neurologic, but constipation actually is common with Parkinson's. It's in the blue book, so hopefully you learned that. So yes, I would want to increase fiber. Taking levodopa, carbidopa with a glass of milk for better absorption. Well, you're supposed to take it with food, but vitamin B6. Vitamin B6 is contraindicated for people who are taking dopaminergic drugs. And vitamin B6 is primarily found in meat like fish, chicken, organ meats, I think, and other high fat foods. And milk is considered a higher fat food. So it definitely is not going to help with absorption. So taking a medication with milk, anytime you take a medication with milk, it's for the purpose of preventing GI upset. It's never to help with absorption. So I don't like B. Schedule protein intake apart from levodopa, carbidopa. That seems good to me because it could prevent absorption. So that seems good to me. And B and C sort of seem like opposite answers. So I'm going to pick C, not B. Offer small, frequent meals if fatigue occurs during meals. Well, that's just a generally good recommendation. Encourage high-fat diet to improve medication absorption. That's actually not true. Remember, the vitamin B6 is contraindicated. It's in a lot of high-fat foods. So no, we don't really recommend high-fat foods. Ensure adequate fluid intake. Yeah, I mean, fiber and fluids are both good. Nutrition-wise. So I don't like B. I do like A. I don't like B. I do like C. I do like D. I don't like E. And I do like F. Okay. So those are the correct answers. Remember, SATA questions are not about memorizing a list of facts. They're never about memorizing a list of facts. SATA questions are always about whether or not you understand a concept. And so I'm trying to teach you facts while also teaching you how to answer questions when you don't know the facts. So because you're probably half the questions on the Nclex, you're not going to absolutely know the answer, maybe more. The worst thing about the Nclex is you're never sure for sure you're getting the right answer because you have to use clinical reasoning on the Nclex. So you have to be prepared to not for sure know the answer. You have to think through it, use common sense and clinical reasoning and say what makes the most sense about what I know about this concept, right? Nutrition, what do I know about oxygenation? What do I know about perfusion? What do I know about neurologic things? What makes the most sense in this situation based on what I know about this concept? That's almost always what they're testing you. Very seldom are they testing you an absolute fact. While caring for a patient with Parkinson's disease, the nurse teaches them a common side effect of long-term levodopa is which of the following: hypotension, dyskinesia, hyperglycemia, hyperthyroidism. I hope you know this answer. So I told you Huntington's chorea was the opposite of Parkinson's, because if you're taking, remember, Huntington's chorea is high dopamine. You have all these uncontrolled movements. So if you're taking dopamine, you can start to have dyskinesia, which is disordered movements. So that is a side effect. You don't stop taking it, because if you stop taking your dopaminergic, then you're going to have rigidity and all kinds of stuff, but you still could have some uncontrolled movements from taking long-term dopamine. A patient with Parkinson's disease is being discharged home with assistance from family. Which instructions should the nurse include to promote the patient's independence and safety? So the whole purpose is to promote the patient's independence and safety. So I'm going to just take each answer and say this will promote the patient's independence and safety. Encouraging the use of assistive devices will promote the patient's independence and safety. That's true. Removing barriers like raised door sills? What is a raised door sill? And thick carpeting will promote the patient's independence and safety. Yeah. I mean, removing barriers certainly will. I don't know what a raised door. A raised door sill, I think, is the bottom. It's having to walk over the door frame, right? So the door's not okay. So you won't trip over it. I got it. Yes. Making sure the patient is discouraged from doing tasks independently will promote independence and safety. No. Using chairs with armrests and firm backs will promote independence and safety. If you're wondering why that is, it's because it makes it easier for the person to get out of the chair. They can push off the armrest, so it can help stand up, and a firm back. If you sink too far into like a couch or a chair, it's very hard to get out of it if you have impaired mobility. So that's why we do armrests and firm backs to promote independence and safety. And that's true. Using a high toilet seat will promote independence and safety. That's true. Refraining from any exercise program will promote independence and safety. That's false. So this is why I want you to learn how to answer these SATA questions, because if you get a question like this, you go, I didn't study this. I don't know. No. It doesn't matter. These are concepts. And if you associate each answer back with the specific concept that they're testing, it becomes sort of obvious. A client with Parkinson's disease is admitted to the hospital with a fever and cough, which the following is the highest priority nursing action: administering the patient's scheduled Parkinson's medication, encouraging the patient to do deep breathing exercises, initiating isolation precautions, assessing for signs of aspiration pneumonia. All right, so it's asking me what's the best thing to do. Now I have to address the problem. So the patient has two problems. They have Parkinson's and they have a fever and cough. All right, so administering the patient's scheduled Parkinson's would address the Parkinson's. Encouraging the patients to deep breathing exercises, I don't see that that's going to help either one. Fever and cough, those are symptoms. I don't see how that helps. I mean, if it told me they had pneumonia or something, then maybe I would do that, but it doesn't tell me that. So I don't see how deep breathing is necessarily going to help fever and cough. Have you ever gotten a fever and a cough and tried doing deep breathing? It just makes you cough more. Okay. Initiating isolation precautions doesn't address Parkinson's, and it doesn't address the fever and cough. Y'all, we don't do isolation unless they have a specific organism that we know needs to be isolated. So don't just go, well, isolate them. No, don't do that. No. Okay, that's way overthinking. So no, I'm not going to do C. Assessing for signs of aspiration pneumonia does not address the Parkinson's, but it does address the fever and the cough. So I'm going to cross off B and C. So then I say, well, administering the Parkinson's addresses a chronic disease, which is Parkinson's. Assessing for signs of aspiration pneumonia addresses acute symptoms, which are fever and cough. I would rather address the acute symptoms, which are fever and cough. So I'm going to assess for signs of aspiration pneumonia. Now, what I don't want you to say is, well, I should always prioritize assessment. That is not true. You should prioritize assessment if there's not enough information to take action. And in this case, we don't have enough information to take action about the fever and the cough. So yes, we need to do assessment. But think about how I just walked through that, right? I said, so B and C don't address any of the problems in the question. A addresses the chronic problem. Now the strategy I just gave you isn't going to help you with every question. That's why you have to have a toolbox of strategies for answering Nclex questions. And that's what I do as I go through all these questions. I'm giving you different strategies for successfully answering Nclex questions. Honestly, if it were me, I'd be writing some of these down, because then what I could do is when I'm going through the Nclex databases is I can go, okay, which strategy might work here, right? Because it makes sense when I'm saying it, but sometimes it's easy to forget it. And what did she say again? 72-year-old patient with a known diagnosis of Parkinson's is admitted for evaluation. Which of the following assessment findings should the nurse be most concerned about? Flat affect, resting tremor, dysphagia, unilateral leg swelling. Okay, so we're always most concerned about the unexpected finding. Y'all, this is a rule. I've taught it as part of the prioritization strategies. I'll say it again, where he's most concerned about the unexpected finding. When you have one patient with a problem, which is Parkinson's, and all the symptoms are in the answers, and this is the rule. One patient with a problem in the question, the symptoms are in the answers. That's the key. We're most concerned about the unexpected findings. So a flat affect is expected with Parkinson's. Resting tremor is expected with Parkinson's. Dysphagia is expected with Parkinson's. Unilateral leg swelling is not expected with Parkinson's. Okay, so you may say, well, I had a Parkinson's lecture and it was 2 hours long and this only lasted like 30 minutes. Okay, I know, right? I said I expect you to have already had your Parkinson's lecture in school. This is not a comprehensive Parkinson's lecture. I get it. What I'm doing is I'm taking what you've already learned, teaching you how to take it and apply it in questions so you can pass the Nclex, because that's your goal. I know it is. You got to pass your Nclex in order to be that amazing, wonderful nurse that you're going to be. I know you will be. And even if you failed before, you can pass Nclex. You can absolutely do it. You got to have confidence going in. All right. Good luck. Thank you for being part of the Clinic Review family.